What you should know about osteoporosis by Junji Takano.
When you say osteoporosis, we immediately think it is caused by lack of calcium. Doctors will recommend you to take more calcium, vitamin D, and sun exposure or sunbathe. However, the latest findings in various hospitals show that the majority of osteoporosis patients are not caused by lack of calcium. Their bones are complete in absorbing calcium. So, what is wrong with them? CT scan results show no signs of osteoporosis, yet the patients easily suffer from bone fractures. What's going on here? We came to know about a new strain of osteoporosis that was discovered since about 2 years ago. The most common type of bone fracture nowadays is spinal fracture. If spinal fracture occurs, the risk of death is 8 times higher than any other type of bone fractures. What is the reason that bones are weakening? Why do patients suffer from broken spine? Important factor to have bone strength, not just bone density. Bone collagen connective tissues are also an important factor to create flexibility. Many of us didn't realize this at first sight. In the past, osteoporosis was viewed more on bone strength, and we never hear and realize about these connective tissues. To improve bone density, it's a common knowledge to do regular exercise and have a higher calcium intake, like by eating calcium-rich dried fishes. But now, we have to think of a new measure to maintain bone collagen connective tissues to have enough flexibility. From this simple measure, you may escape from the risk of death caused by fracture of spinal bones. To measure or determine strong bone and bone mineral density are not as easy as what you may think. Clinically, it has to pass various tests. Well, what is the major cause that leads to reduction of bone collagen connective tissues? Do you believe that is because of high blood sugar? The major component of bone, which is about 1/2 of its structure, is calcium, and collagen is the other half. Collagen fibers run through hundreds of bone materials calcium, and the bones that we know are made. You can imagine that the bone materials calcium are somewhat bonded by collagen and kept with reasonable flexibility. However, when blood sugar increases, the collagen will be joined as if there is adhesive cement around, and the bone will become brittle. To avoid the increase of blood sugar, exercise is one of the best things to do. Aside from it, we recommend you to take a balanced diet that contains vitamin B12 and vitamin B6, and foods such as mackerel, sardines, clams, folic acid, broccoli, spinach, garland chrysanthemum, soybeans, and asparagus. By taking these foods, you can have strong, flexible bones.
3 common myths on osteoporosis.
1 myth: young people should not worry about osteoporosis. Wrong. You will not realize that you have osteoporosis until you have this condition in advanced stages. That is why it is very important to begin proper nutrition and regular exercise as early as childhood to promote healthy bone. 2 myth: only women get osteoporosis. Wrong. Although less common, men can get osteoporosis too. 20% of those affected by osteoporosis are men. 3 myth: drinking plenty of milk will help you prevent osteoporosis. Not entirely true. Even though drinking milk is a good way to get calcium, it is not the only factor in preventing osteoporosis. There are others as mentioned in this article. About the author, Junji Takano is a Japanese health researcher involved in investigating the cause of many dreadful diseases. In 1968, he invented pyroenergen, the first electrostatic therapy device for electromedicine that effectively eradicates viral diseases, cancer, and diseases of unknown cause.